We'll get started shortly, but as a reminder, before we begin, this meeting will be recorded. We encourage you to keep your camera on throughout the meeting, especially whenever you are talking. And please keep yourself muted whenever you are not speaking. Also be aware of who you're sending messages to in the chat. It could default to everyone, which includes members of the public. And then we will get started shortly. So let me go ahead and open the webinar and then we'll get started. All right, I believe the webinar is open. All right. Good afternoon, advisory committee members and members of the public joining us for this meeting. I am Giselle Sanchez. I am the Acting Council Coordination Manager here at the California Interagency Council on Homelessness, and I have the pleasure of opening our meeting today. A few reminders before we can begin. This is a 2-hour meeting, and while we will do our best to keep to this time frame, there is a possibility that we may not stick to that. So this meeting is also subject to the Bagley-Keene Open Meetings Act, which requires that it be open and accessible to members of the public. The agenda is posted 10 days in advance of each meeting, and a quorum must be met to hold the meeting. That means that and members cannot meet in private to discuss committee matters of the meeting. And public comment will be available. All right, next slide, please. Thank you. Before we begin, this is our agenda for the afternoon. We have our call to order, tribal land acknowledgement, and roll call. After our roll call, we will be starting with advisory co-chair opening comments, followed by executive officer comments, followed by a presentation on the California Homelessness and Housing Agency, the status of the implementation. We will also have a presentation on Medi-Cal interventions and innovation. And then we will close our meeting with general public comments and then final remarks and adjournment. There will be an opportunity for general public comment near the end of this meeting. We will allow for a maximum of 2 minutes for each comment. We welcome all public comments and feedback. However, due to the structure of this meeting we are in, we may not be able to respond to them. For this reason, if you have any specific questions that you'd like answered, we ask that you please email us at calich@bcsh.ca.gov. With that, the advisory committee to the California Interagency Council on Homelessness is hereby called to order on this day, November 5th, or just kidding, February 4th, 2026 at 2:04 p.m. Next slide, please. Thank you. And then one more. Thank you. I will now read the tribal land acknowledgement. We wish to acknowledge that Sacramento is the unceded homeland of the Southern Maidu, Valley and Plains Miwok, the Nisean people, the Patwin Wintun people, and members of the Wilton Rancheria tribe who have inhabited this landscape since time immemorial. We extend our gratitude to the ancestors of all California Native American tribes and their descendants as we recognize that wherever we are joining from in our virtual community, that we are all on California Native American land. Thank you. Next slide, please. All right, I'll go ahead and call the roll. This is the attendance roll call for the committee. We need a majority of members or a quorum to officially meet. For this is 12 members. Committee members, after I call your name, please say present or here. If you are designee for a member, you may state your name after I call the committee member's name. However, this does not count towards quorum. And apologies for any names that I mispronounce. All right, we'll start with Samaj Algiri. Or Samaj Algier.
Here.
Thank you.
Yes, ma'am.
Sangai Armstead. I believe you might be here. All right. Lauren.
I see Judge Armstead on the Zoom, so she may be having trouble unmuting or something.
Thank you. We'll note you as here. Thank you, Judge. Lauren Cardin.
Here.
Thank you. Joseph L. James. Doshelle Kendrick.
Present.
Thank you. Kevin Kwan.
Here, I'm present.
Thank you. Graham Niles.
I'm here.
Thank you. James Mackey.
Here.
Thank you. Mary Maldonado. Alejandro Martinez.
Present.
Here.
Here.
Oh, thank you, Mary. Thank you, Alejandro. Novalee McDermott.
Present.
Thank you. Christina Mill. Lisa O'Connell.
Here. Sorry, I was having a mute problem.
Oh, thank you. Tanisha Owens. Carolina Reed.
Here.
Thank you. Alex Sanchez.
Present.
Thank you. Alicia Sebastian. Adrian Shilton.
Hi, present.
Thank you. Carla Thomas. Alex Vidzotsky.
Here.
Thank you. Javon Wilkes. And Roxanne Wilson. Thank you. All right. I believe that we do have a
And
quorum.
I
We
think
have...
I was muted or something, but I'm also Songhai Armstead's on.
Thank you. We noted you as present. All right. With that, we have 14 members present. We do have a quorum. So we could move on to the next slide. I will pass it over to our advisory committee co-chairs, I think represented by Alex, to facilitate this next section.
Thank you, Giselle. Good afternoon, everybody. And thank you to all the staff at Cal ICH for all the work. We're in uncharted waters, I think, right now. I keep using that phrase to describe the circumstances we're working under. And I know that public agency folks such as yourself are working long hours to be able to respond to these circumstances. And I know how challenging that can be. Also want to acknowledge that my co-chair, Roxanne Wilson, is responding to an urgent situation in Monterey County and can't join us today, but rest assured that she would be here if she could. So really just want to open by talking about two things today to help hopefully frame some of the conversation. One is how our state is responding to some of the federal circumstances we find ourselves in. And second, how as a state we're going to think about sustaining the progress that we've rightfully been celebrating a little bit in recent weeks. So I want to start by noting on the federal side, we've gotten a glimmer of good news this week on homelessness. Congress passed an appropriations bill that in some small ways, I think addresses the crisis we're seeing with federal homelessness funding. The federal bill sets some benchmarks for HUD to get funding out the door for expiring COC contracts. HUD is required to immediately renew for 12 months all COC contracts expiring in the first quarter of 2026. If HUD has not made awards by April 1st, they'll be required to fund and renew all contracts that are expiring in the second quarter. And if they haven't made awards by July, they'll have to renew all the contracts that expire in Q3 and Q4. That's good news, but I want to emphasize that we are not out of the woods yet. We need to see how the cases that are before the courts, how those play out, and ensure that HUD isn't able to make other awards, right, in a way that's are extremely damaging to California and to thousands of folks that are, holding on to their PSH, holding on to rental subsidies before we can really kind of breathe a deep sigh of relief. We also got some good news on the EHV front with HUD allocating some additional money for tenant protection vouchers that's going to mitigate some of the loss of that EHV money. But I want to emphasize that it is mitigating only some of the loss, and we don't really know the full scope and the extent to which that's going to be able to keep the 15,000 EHV voucher holders across California housed. There's already damage that has happened from this federal instability. I just heard last week about a COC-funded PSH complex that already handed out eviction notices to 40 seniors, many of whom are disabled because their COC grant was expiring this month. And the threats of more of this happening are real, still very immediate, and still putting thousands of folks at risk. So we saw the state, I think, start to think about our response. We saw a memo go out late last year from HCD to HAP grantees, emphasizing the flexibilities that are already there in HAP as a way to address some of the federal instability. That's fine, and I think we appreciate HCD staff outlining that for folks, but there's more we can do. I think we can do better. At the very least, I think we don't want to see the state making it harder for folks at this moment and piling on requirements that are going to make it even more challenging to keep folks in their housing. We need to make it easier, for example, for localities to get that second tranche of HAP 6 funding. And, I would love to ask why that first tranche of HAP 6 money has taken so long to get awarded under these circumstances. That's a little challenging to comprehend at the moment. Folks are being asked to hit a lot of benchmarks with, to get that second tranche of HAP 6, and those benchmarks are going to be near impossible to hit if federal funding is not there. And we also need to be doing things like ensuring HAP 7 isn't such a big lift, right? And avoid pushing for requirements like a pro-housing designation, for example, that's going to punish numerous parts of the state and ultimately really just punish the people experiencing homelessness that aren't able to then get those resources. So I think there's more we can do as a state to think about how to be creative while still maintaining that focus on what we know works, which is using this money to get people back into housing to end their homelessness. Second, how do we maintain this progress moving forward? In the governor's state of the state, he lauded this 9% reduction in unsheltered homelessness. I think that's just the beginning of some of the things we should be celebrating. We should be celebrating a HAP program, for example, that's housed and ended homelessness of over 90,000 people since the beginning of 2023. We should be celebrating that while we saw homelessness, sadly, in the rest of the country rise by 24%, from 2023 to 2024, we saw it flatten in California, right? The resources we've put in, the policy changes have made a real difference. But we're not going to sustain that progress if we pull away from what is working. We've seen this progress because of the investments, right? HAP at $1 billion for 4 years straight. Unfortunately, between last year's budget deal and the budget that was proposed by the administration this January, we're looking at only $500 million of HAP across 2 years. That's a 75% reduction, right, in HAP over a 2-year span. The administration and especially our friends at HCD have worked really hard to institute changes to HAP and ensure more money is flowing towards the solutions that we know work. Things like permanent housing. That's a big reason why this program is working, why we've seen success. So after all that work on accountability, after all that progress to get reductions in homelessness, why would we then, pull back on some of those investments? We can give all that progress right back. And if we do give away that progress, it's going to be much, much harder to make the case to the public down the line to increase investments. So as budget season starts to kind of heat up, I'd implore our friends at the administration and the state to keep that in mind. Those are just a couple of things on my mind as we open this meeting. And thank you again for the opportunity to share some thoughts, and looking forward to hearing from my colleagues on the committee over the course of this meeting.
Thank you, Alex. All right. We could move on to the next agenda item. We have executive officer updates. And for this agenda item, I am passing it over to Courtney Tucker.
All right. Thank you, Giselle. First, I just want to start off with thanking our co-chair, Alex Wysotsky, for his thoughtful opening remarks and for his continued commitment to this work. Our executive officer, Megan Marshall, deeply appreciates your leadership and steady partnership here. And on that note of our executive officer, Marshall, she also sends her appreciation to the full committee for your flexibility today. And regrets her unexpected absence due to a death in the family. So while she is unable to be here in person, she remains fully engaged and has asked me to provide this update on her behalf. So I'm going to first start with the federal budget and COC program update. A lot of what I'm going to share, want to acknowledge what Alex just shared with the committee, and we'll be reiterating some of those comments that you've just heard. Yesterday, the president signed HR 7148, excuse me, the Consolidated Appropriations Act of 2026, which funds the majority of the federal government through September 30, 2026. This includes several important developments for the HUD Continuum of Care program, due in large part to sustained and coordinated advocacy across California and the nation. The Appropriations Committee prioritized expedited renewal of fiscal year 2025 COC program grants, reducing the risk of sudden program interruptions. The Act also includes protections for the fiscal year 2026 COC competition, offering a buffer against the steep funding losses previously anticipated under HUD's earlier proposed scoring changes. I want to take a moment to thank all of our partners on this call for your advocacy on this critical issue. Last, and on the note of funding, I want to acknowledge that the current state budget does not include an 8th round of HAP. However, existing HAP rounds are multi-year and remain active through 2029, meaning local governments still retain substantial resources to support interim housing, permanent housing, and system improvements over the next several years. We understand one-time investments cannot resolve a multi-decade in the making issue, and so Executive Officer Marshall is looking forward to engaging this body on a gaps analysis as part of our third-year activities for the action plan. Next, want to give an update on the state of the state. In the governor's state of the state address, the administration highlighted, as Alex also mentioned, a projected 9% reduction in unsheltered homelessness, reflecting early improvements captured in the point-in-time trends. It is important to note this projection is pending HUD certification through the annual homelessness assessment report, which will finalize national totals and formally validate state-level reductions. Just want to close with some CalICH statewide updates as well. This last month, CalICH released the HEART Toolkit, which stands for Homeless Emergency and Active Readiness Toolkit. This toolkit offers practical evidence-based information and resources for local governments to work together to coordinate efforts across homelessness response system and emergency management systems to support people experiencing unsheltered homelessness during emergency and disaster. It also supports improving housing outcomes in alignment with Housing First. And additional statewide initiatives continue moving forward. Those include the administrative transition of CalICH into the new California Housing and Homelessness Agency in 2026, which we'll hear more about here shortly. And this fiscal year, CalICH also rolled out a new dashboard, the HELP Act dashboard, and CalICH intends to release a new version of that in the fall. We are also beginning work on new dashboards that track state program outcomes data pursuant to AB 799. In closing, I just want to share that Executive Officer Marshall looks forward to returning and engaging directly with this committee at the next meeting. If any questions arise today that required statewide policy interpretation, statutory context, or deeper technical analysis, I will document those and bring them back to her for a direct response. Thank you.
All
All right, thank you, Courtney. We will move on to our first presentation. Sorry, next slide, please. Thank you. So yeah, I'd like to welcome the Deputy Secretary of Homelessness, Dr. Shika Rakwama, for a presentation on California Homelessness and Housing Agency, and the status of the implementation.
Thank you, Giselle. Next slide. So as Giselle mentioned, and Courtney mentioned this too, I'd like to give all of you a quick overview of the governor's reorganization plan when he will be splitting the Business Consumer Services and Housing Agency into two separate agencies, the Business and Consumer Services Agency and the California Housing and Homelessness Agency. And my presentation today will focus on the new California Housing and Homelessness Agency, or CHHA. Next slide. So today, our current Business Consumer Services and Housing Agency includes, as you can see on this slide, 12 state entities that range from consumer protection, housing, homelessness, and civil rights. You can see how broad and diverse the portfolio is under BCSH, including entities that have sometimes non-overlapping activities like horse racing and housing. Since its creation as part of the previous governor's reorganization plan that was in 2012, BCSH has grown by nearly 50% in size and scope. So with expanded responsibilities, there's a greater need for more coordination, efficiency, and accountability. Next slide, please. The reorganization creates two focused agencies, each with clear missions and cabinet-level representation. So you have the Business and Consumer Services Agency, or BCSA, and that will be dedicated to providing effective and efficient regulation and consumer protection, and that will have some of the departments that were on the previous slide. And today, like I said, I'm going to focus on the California Housing and Homelessness Agency, CHHA, which is dedicated to addressing the full spectrum of California's housing needs. So you will see on this slide, it addresses the full range of housing needs, from homelessness prevention to affordable rental housing to home ownership. There are 5 core entities: the California Interagency Council on Homelessness, or CalICH, which, as you all know, and thank you all for being part of this, providing state-level coordination on homelessness policy and response. Then you have the California Housing Finance Agency, or CalHFA, which provides financing tools for rental housing and home ownership. We have the Civil Rights Department, or CRD, which advances fair housing and equal opportunity. The Department of Housing and Community Development, or HCD, which leads housing policy, planning, building standards, and more. And in the middle, you can see the new Housing Development and Finance Committee, or HDFC, which I'll talk a little more about, to streamline affordable housing funding and processes. Next slide, please. So here's the vision for the new California Housing and Homelessness Agency, or CHHA. A California where civil rights are guarded and everyone has a place to call home. Next slide, please. And here's a little bit more of those 5 departments. Under the reorg, many of the departments' functions will continue just as they are now, with some changes. CalHFA and CRD remain largely unchanged. CalICH will continue their work while becoming an independent business unit within CHHA, the new agency. HCD will continue to administer government-to-government financing, federal financial assistance, fair housing, policy planning and accountability, tribal housing programs. And then there will be a phased transfer of Supernova funding programs to the new Housing Development Finance Committee, or HDFC. HDFC, this new entity, will hold those multifamily competitive affordable housing financing applications and awards. So through these 5 departments, the new California Housing and Homelessness Agency will reflect the entire housing continuum for the state. CHHA will continue to work across the state administration where housing overlaps with other issues like transportation, climate, health. And so this means we'll continue working hand in hand with the California Health and Human Services Agency, with CalVet, the California State Transportation Agency or CalSTA, Strategic Growth Council, and more. So all current programs and services will continue during the reorg, and our intention is to have minimal disruption to services and programs by phasing the reorg transition over time. Next slide, please. So a little bit more about the Housing Development and Finance Committee that was mentioned. The new Housing Development and Finance Committee will harmonize many state sources into a single coordinated entity with a governing body that will deliberate and make decisions in public meetings for more transparency and engagement. And pursuant to Assembly Bill 519, the creation of a single funding application process will be a top priority for HDFC. HCD's Supernova programs and the subsidy component of CalHFA's Mixed Impact program are also slated for transfer to the new Housing Development and Finance Committee. We are actively planning the implementation of these programs so that they work as seamlessly as possible. HDFC will build on current funding partnerships and models, including streamlined programs, clear rules and appeals, and transparent decision-making. Next slide. And many of these funding programs, exist for good reasons and each shaped by different laws, policy priorities, and unique funding sources. So we are trying to be really thoughtful and bring them together in a way that is intentional and ultimately delivers more affordable housing faster. We're also identifying opportunities for data sharing, consolidated reporting, and coordinated monitoring. This builds on the work that is currently underway to develop a single application for state affordable housing funding and aligned asset management through AB 2006. Next slide. And finally, here's the general timeline of the reorg, which a reminder goes into effect on July 1st this year. We've been working to develop the administrative frameworks and other critical reorg activities to prepare the split into two agencies. We will continue with outreach through this spring with the goal of developing internal recommendations and processes for the NATE entities by late spring. So keep an eye out for the two new agencies when we go live in July 2026. Thank you. Back to you, Giselle.
Thank you. Yeah, I believe we have time for questions if there are any questions. I also want to note that we have two committee members who arrived late, Tanisha Owens and Javon Wilkes. Thank you for joining. All right. Does anybody have questions about this reorganization?
The good news is oh, there you go, Alex. I see Alex's hand.
Yeah, excited to hear my colleagues' questions, but I was also just wondering, can you say more about like Cal ICH's role as a policy-making body in regards to other departments, right, that now hold some of these funding sources that policy will apply to? Is that role going to look different, the same? Like, how does that change with Cal ICH kind of sliding in as a department?
I was just going to address that. Nothing will change for Cal ICH. Their role will remain the same. You'll still have the body, the Cal ICH council meeting. There may be actually some additional kind of interactions given the split BCSA has the Department of Real Estate, because we're also trying to build even more coordination. So the only good thing change is Cal ICH will become its own department and business unit. So it'll have a little more authority and autonomy, but it will remain within the same kind of governing structure and governing board. So nothing will change for the advisory committee. We will have different email addresses. We will have @chha.org. So that will be a lot of the behind the scenes stuff, which I am not involved with, is all the kind of admin and back end IT stuff that needs to happen by July 1st. And Graham, I see your hand. And it's also not going to be like a light switch. This is why there's going to be kind of a transition over time to make sure everything happens seamlessly. Graham?
Great. Thanks, Dakshika. Appreciate it. Appreciate your update. I guess a couple of comments. One is, since the concept around creating this agency is to have a more focused strategy around housing and homelessness and to take the other components that were in BCSH and let them sit on their own, I would hope that then in the gap analysis that is going to be done, that there's a look at what needs to be put in place so that we're actually addressing homelessness on an ongoing basis, as opposed to what feels a little like a haphazard when money comes in the door. And so it's a much more focused effort overall, and that the gaps also look at the reality, and Alex mentioned this earlier, that it has been 19 months since HAP 6 was approved by the legislature and enacted by the governor, and 40% of that money has gone out the door after 19 months. And we may well be in a place where the creation and full operation of the Homeless and Housing Agency will have occurred in half the time of getting money out the door to actually assist people who are homeless or at risk of homelessness. So I just encourage a strong look at that. We are struggling in a number of spaces related to what feels like increasing requirements in order to access dollars. And the requirements are often not related to directly addressing homelessness. They may be laudable policy goals, but they are not directly related to addressing homelessness. And so we would encourage a look at that, so that when in this world where there's so much additional federal instability and real reductions, that we move the barriers out of the way as much as possible for many folks who are trying to deliver services on the street. And so I would encourage a look at that. And then just a final note, which is around the pro housing designation, which is part of the overall requirements. There are a number of counties that I think most would argue or assert are 100% pro housing that are struggling mightily to get that actual designation. And so some of that it has been a little stuck in HCD, and so it might be helpful to help expedite some of that. So I'm aware of at least 2 counties in the last week where this has been a significant issue, and I've heard it from others previously, where they get stuck in what feels like a black hole of going back and forth and requirements that seem to be not in statute, but are being added to that. So if there's a way that we can all capture what those things are, and I'm sure you have some as well, so that we can get the barriers out of the way and focus on the core charge here, which is to reduce homelessness in California. So thank you.
Graham, yeah, I noted those points down. We'll relate them to HCD. And then, as you know, in any budget process, which Alex mentioned, there's the kind of, we'll see in May what happens, and the legislative process as well as anybody else. So look forward to continue to engage with you guys.
Good. Thank you.
Thank you. Are there any other questions? All right. Thank you so much, Deputy Secretary.
Thank you for having me.
Sorry, at the risk of prolonging this here, can you talk about whether, obviously there's so much more emphasis on homelessness, both from a funding and policy perspective coming out of departments like the Department of Healthcare Services, and just how this might be able to ease some of the collaboration between, HCD and DHCS. How do we, for the departments that aren't necessarily coming under this new agency, how do we see this improving collaboration?
Yeah, because I think one of the things obviously that we're going to build on and kind of enhance and refine is the CalICH council structure, where there's a reason why you have Secretary Moss and Secretary Johnson being co-chairs to kind of create that synergy and collaboration between housing, homelessness, and human services, healthcare, behavioral healthcare. I will say that on HomeKey Plus, that is where I've really seen deep collaboration between HCD and DHCS, as well as BCSH and CalHHS, because HomeKey Plus does kind of require a lot of collaboration, especially around the services piece. So we will continue to kind of look at those kinds of programs, Alex, but also go beyond, because we have models, and this is where I mentioned in one of the slides, there's a housing and transportation steering committee which actually came about in the 2012 reorg, because you may remember I wasn't in California at the time. Transportation was taken out of our agency and they set up a standalone transportation agency. But to make sure there continued to be alignment and collaboration between transportation and housing, you have a housing and transportation steering committee. So we are looking at those kinds of models to make sure, Alex, to your point, there's even deeper kind of collaboration with DHCS and HCD and beyond to make sure that we are really leveraging and taking us all of state government approach to this in the future. And the reorg is a good mechanism to really think through those ideas. But thank you for that comment. We agree.
No, thank you, Deputy Secretary. Appreciate the response.
We are ahead of schedule, so don't hesitate to ask any questions. All right. Does anybody else have any other thoughts? Carolina, I see your hand.
Yeah, thank you. And thank you, Takshika, for the wonderful presentation. It's exciting to see all of these developments. I think one question maybe back to CalICH is, what kind of support do you think would be helpful as you implement these big changes? And is there room for, I'm thinking, for example, working groups of various types of practitioners to provide feedback on what parts of the integration are working well or where there's room for improvement? Because these are big changes. And I think to Alex's point too, right? Like thinking about the whole range of different kinds of permanent supportive housing providers who might have very different experiences depending on what funding they're tapping into and which agency they're interacting with more, whether or not it might make sense to create some working groups to get that kind of feedback as we build this new entity.
That's a very good thought, Carolina. And since Megan's not here, that's something I'll take back to her. On the HTFC side, and I know the Turner Center is involved there to really think through kind of the consolidation and better alignment of financing programs. But I think that's a good thought to think about the big picture housing ecosystem, if you will, and think through how, as we move into this reorg, and this is why it's not going to be just July 1st things are done. We're going to keep learning and improving and refining what it means to be CHHA. So we'll definitely take that back, Carolina, and let the secretary know as well.
Thanks so much.
Deshelle?
Yes. Hello. Thank you for
Hi
the
there.
presentation. Just a little more of a follow-up on Carolina's comments today. Has there been any efforts or any listening sessions in various counties and different public housing formats prior to making the decision of this change?
Yes, this has been a multi-year process. So this actually went through what is called the Little Hoover Commission. Some of the folks on this committee came and testified, and there have been listening sessions. In fact, there will be a session with the tribal governments later this month. So yes, this has been an ongoing kind of effort. The Shell public housing authorities have been involved, as well as local government and stakeholders like Carolina and other academic researchers, advocates, service providers, as well as legal aid attorneys, because as you saw, Civil Rights Department is involved, which includes a lot of fair housing activities to protect people from housing discrimination. So yes, definitely there will be, but then there will be more in the future once we have more of the details. So look forward to coming back as well and letting you guys know if there are other ways to connect to this, Trishelle.
Thank you.
Thank you for those thoughtful questions. All right, anything else before we move on to the next agenda item? All right. Thank you so much, Deputy Secretary. And we look forward to the implementation, what it brings. I will now move us over to our next presentation. I will turn it over to Glenn Song, Policy Advisor for Homelessness and Housing at the Department of Healthcare Services, for this next presentation. And Glenn, thank you so much for your flexibility on starting this presentation early.
Oh, of course, no problem at all. Hi, everybody. Glenn Sang, Advisor for Homelessness and Housing at the Department of Healthcare Services. First off, thank you so much for having me. It's a pleasure to speak here about some of our initiatives that we have for housing through Medi-Cal, specifically what I'm going to talk about today. So just very excited to kind of go through that and answer any questions you might have. Can you go to the next slide, please? I'm going to focus a lot on transitional rent, which is a new benefit and service that we have through Medi-Cal, and it just went live. I'll try not to spoil my slides ahead of time, but I will get into all the details of transitional rent today. But first, can you go to the next slide, please? I always like to start off these presentations or conversations in a way that kind of level sets on what housing for health really means for us and the lens that we look at it through a health lens. It's a really neat, endeavor we've taken on over the last several years. I just want to ensure folks are understanding just like how Medi-Cal and how we look at housing really impacts someone's health works. And then I'll get into some of our efforts over the last several years, but then really deep dive into transitional rent, out with how we expect managed care plans, Medi-Cal plans, and also county behavioral health systems to work together too. Next slide, please. Okay, so this is kind of what I call my level setting slide, and it probably goes without just how much California is impacted by homelessness right now, and just how great of a need it is. And when we look at homelessness through our own healthcare lens, we really look at like, well, how does a lack of housing, how does housing instability really start affecting someone's health? And I can kind of go through all the data. I think it's pretty self-explanatory, but what I like to do is try to just talk in examples. And, one example I came across recently, I was talking to a member. So when I say a member, I'm referring to someone who is on Medi-Cal and enrolled in a Medi-Cal managed care plan. Let's call her Elena. Elena was living on the street, and she had several emergency department visits while living on the street. And the reason for those visits, a lot of times, it was due to her asthma situation. So Elena's asthma, it would spiral out of control because she was sleeping outdoors during cold, damp, wet nights, which really triggered her asthma attacks. I think for anybody who's experienced asthma or knows anybody with asthma, we know how some of these breathing situations or lack of an inhaler can really exacerbate your experience that you're having with asthma. And also while living on the street, you know, it's really focused on like survival tactics, like where's your next meal going to come from, where you're going to get shelter. And often what Elena would do is lose her inhaler. And then even when she did have her inhaler, she lacked access to have her prescription refilled regularly. And when we look at it like, well, how could we have better improved Elena's health experience or her health outcome? Because she's had, again, several visits to the emergency department. I think we can look at like what her health trajectory would look like, which isn't the most promising. And instead of just constantly treating her in an emergency department or just constantly refilling her inhalers, which is needed, but it's like if we go upstream a bit and start saying like, well, could her health outcome be more positively affected if we had treated her housing situation instead of just her visits to the emergency department? And so that's kind of like the premise of like where and we started looking at like how else can we insurance to kind of go upstream and, you know, use it more strategically in a way that helps address like her health and her asthma situation. And a lot of that's like, okay, if we treated her housing, then maybe she can keep better track of her asthma. Maybe we have folks like an enhanced care manager who can work with her and ensure she gets her appointments on time or has transportation or access to the pharmacy or has, you know, things delivered directly to her because she's housed. And that's, and I say all this in a way because there's so many like examples of just how housing really is impactful on one's health, and a lack of housing can really be detrimental to one's health. And I just try to encapsulate that so folks just kind of look at it through like the lens of like how we do through like Medi-Cal and everything too. Can you go to the next slide, please? So in 2022, DHCS, we rolled an initiative. It's the California Advancing and Innovating Medi-Cal. And it really started before that through like whole person care pilots and health home program pilots where we tested out some of these concepts and premises, which really showed a lot of strong and positive results where we started seeing lower utilization of like emergency departments, lower utilization of inpatient stays, savings on healthcare costs. And it really kind of led us to CalAIM. Another way to look at CalAIM, it's not necessarily like a program so much as it is a transformation of Medi-Cal. So in a way, it's just like, how are we better utilizing Medi-Cal? What else can we use Medi-Cal for to be innovative and pay for, you know, services that I'm listing here? And two of those key services are enhanced care management. Or assign a care manager to connect you with, you know, things that address your health, like social drivers of health, connecting you with, like I said earlier, your clinical needs, but also non-clinical needs. You're assigned someone as a lead care manager to really help you navigate various systems. You know, I've even seen someone just stay on an 800 call for like over an hour where you're on like wait lists or wait lines or wait times to try to get through to someone, connect you with CalFresh, I like to say as well. And then also the other pillar that we have are community supports. Community supports are like alternative uses of Medi-Cal. So Medi-Cal is paying for like emergency departments, your like a doctor's office, things like that. But now through like community supports, and I'll go over what the list is, but you can start paying for things like, can you have someone help you find and locate housing, for example? And there's 14 of those, and I'll go over that on the next slide. But the last one I want to mention here is transitional rent. So transitional rent is really kind of our approach where we're doubling down on Medi-Cal transformation. And I'll talk a little bit more about that, but just again, just wanted to start previewing some of like these services that we are offering through Medi-Cal. Next slide, please. So before I go any further, I get asked a lot about eligibility, where can I find more information? And what I like to do is point to like our policy guides for community supports, and that I'm gonna focus on community supports today. So this is what I call like our source of truth. And we split our community supports policy guides into 2 volumes. It started to get very lengthy. With volume 2, if we can go to the next slide, please. With volume 2, reflecting all of the related community supports. So you see here listed on the right side under volume 2, we have housing transition navigation services, housing deposits, housing tenancy sustaining services, and then at the bottom you see the new transitional rent. So any information that you want on these services, they live in our community supports policy guide, and that's probably the most comprehensive and robust detail we have on them. And it's just really our truth. Next slide, please. And next slide. So I'm going to operate off the assumption that most folks are familiar with some of the community supports that we've launched to date. Like I mentioned, housing navigation, housing deposits, but really what I'm excited to talk about here today is transitional rent. And transitional rent, I like to try to keep it very simple because it's a very complex benefit that we've rolled out. There's a lot of nuance to it. But at the end of the day, what transitional rent is, it's 6 months of straight up rental assistance paid through Medi-Cal for members who are experiencing or at risk of homelessness and meet certain additional eligibility criteria. And the way we envision transitional rent, it's, we want to connect members who are at most risk and are making critical life transitions. And I'll get into that, please. And I'm going to spend a little time on this slide. It's what I like to call our wall of words. This is our eligibility criteria, and it's a lot. So I'll do my best to make it as simple as possible. The way I like to describe the eligibility criteria is, first and foremost, if you're on Medi-Cal and you're enrolled in a managed care plan, that's how you have access to these services. We've had a big shift where we moved a large chunk or the majority of our members under a managed care plan. So managed care, like your Kaisers, your Anthems, your partnership health plans, or any other local health plans that are contracted with DHCS to administer our Medi-Cal programs. And for transitional rent, there's 3 buckets here for eligibility. So to be eligible for transitional, you have to meet a component under each of these buckets. You don't have to meet all these orange bullets all at once, but you do have to hit on one item under each of these 3 buckets. The first bucket is what we call our clinical risk factors. So again, this is kind of like our tie into the health component, where these services are medically necessary. And under clinical risk factors, that can include meeting access criteria for specialty mental health services. You can have one or more serious chronic physical health conditions, things like diabetes, hypertension, for example. Another clinical risk factor that we're very excited to have included here is individuals who are pregnant or postpartum up to 12 months. And then for the other ones, number 2, I think this one's a little bit more straightforward, where you have to be experiencing or at risk of homelessness. And then lastly, 3, making those critical life transitions. And the way I look at this is like, who or what are other entries into homelessness? And I look at this as, a pretty strong reflection of that. So you got individuals who are exiting or transitioning out of institutional settings or residential settings, carceral settings. So those are like your state prisons, county jails, youth detention facilities, other like interim types of housing. So that could be like domestic violence shelters, for example. But also we also have like kind of like high risk populations, such as those members who are experiencing unsheltered homelessness, for example, or transitioning out of foster care. So the reason why it's like a lot on this slide, and there's actually an even more dense version of this as we kind of break down what each of these means. It's because we really try to take an approach where we wanted to be as expansive as possible to ensure the reach of this benefit. So I know it's a lot on this eligibility slide, but hopefully that helps kind of break it down. Can you go to the next slide, please? All right, so because transitional rent, I'll just be upfront and say it's a very complex benefit that we are administering, but we are implementing transitional rent in phases. A lot of that is because each of these populations I'm listing out here under homelessness, they are very, have unique needs. And the first population we went live with, and it's live right now as of 1/1/26, that's the behavioral health population of focus. The behavioral health population of focus, those are for members who meet access criteria for especially mental health services, drug medical, or drug organized delivery systems. And even though it's behavioral health, you still have to meet those other two buckets that I mentioned, like experiencing at risk of homelessness and then meeting some of that transitioning criteria as well. The other populations of focus we have are listed out here. I just want to note that we just went live with behavioral health, but for these other populations of focus, we have not gone live with those yet. And this is not like the order in which they'll go live, and we don't have a schedule for them to go live yet. Those are internal conversations that we still have to have as a department, and then with some of our stakeholders too. But right now, behavioral health is the first one to go live, and that's a mandatory coverage. And I failed to mention this earlier, but what I wanted to point out with transitional rent, it's unique in the fact that this is a mandatory service that managed care plans have to cover, and also why we're rolling out with like a phased implementation. The other community supports I listed, those are optional services that plans can opt to cover. I'll just say that for like housing navigation, housing deposits, and housing sustaining services are covered by all plans and all statewide. Next slide, please. So what does transitional rent cover? Transitional rent, this is, again, straight up 6 months of rental assistance, but that also includes kind of like those pesky costs that landlords also charge as part of one's rent. Those could be like storage fees, landlord paid utilities like water, sewage, garbage, for example. Some of those extra things that are rolled up into someone's rent and are paid to the landlord. So those are covered under transitional rent as well. Next slide, please. A little redundant on my part, but I just kind of want to plant a seed here. I mentioned that we are implementing transitional rent in phases. Phase 1, behavioral health population focus, that's currently launched right now. Another reason why we chose behavioral health, it's because on July 1st of this year, our county behavioral health delivery system and partners, they'll be going live with their Behavioral Health Services Act. That's BHSA for short. And under BHSA, that's a different funding stream that counties have. And our goal and our vision was to align the services under transitional rent and through managed care plans along with those offered under county behavioral health. And the reason why I'm emphasizing BHSA is because under BHSA, counties have this ongoing funding source where 30% of that bucket needs to be spent on housing interventions. There's some tie-ins here with Medi-Cal under managed care plans. I'll talk about that later on in this presentation. Next slide, please. Now, one of the questions I have too is like, well, how does one get transitional rent, or how is transitional rent paid? And similar to how, if any of you have experience with managed care plans, what managed care plans do, one, they're contracted with us to deliver these services as part of like, our delivery for Medi-Cal. But two, managed care plans, they need to create their own network of providers. So plans will contract and execute contracts with local providers to deliver transitional rent. And those providers in turn are the ones that pay landlords themselves. So the payment comes from us to the plan, to the provider, and then to the landlord. The plans don't pay the landlords directly. Again, it comes from the provider. Let's go to the next slide, and I'll talk a little bit about who the providers are or can. So with transitional rent providers, I'm probably oversimplifying this, but another way I like to say it is like a lot of these providers are check cutters. They ensure rent is paid on time every month for the member. They ensure that the housing unit meets habitability standards. Sorry, that word. And then like, who can they be? Well, they can be any number of provider types. It could be, county behavioral health agencies. Those are first and foremost right now because we just went live with that population. So we're seeing a lot of county behavioral health agencies become transitional rent providers. It can also be flexible housing subsidy pools, COCs. What I would love to see is more like public housing authorities and create connections with PHAs, and as they administer rental subsidy programs in their own right too, and have experience with how to administer these programs. So these are just some examples of who are allowable providers, but really our plans are like hard at work canvassing their localities on who can deliver transitional rent for them. Next slide, please. So I know I'm covering a lot of information, so I'm gonna throw a lot out at you, but I promise we're getting towards the end where I'll start taking some questions. So just thank everybody for soaking in all this information. I know it's a lot. The other thing I wanted to point out with transitional rent is where can you use transitional rent? And when we looked at the different setting types, there's a number of approaches we could take, but ultimately where we landed was, yes, let's use transitional rent in both permanent and interim settings. And even through this exercise, we were like, well, should we define what shared housing is? Should we define tiny homes? Should we define everything? We actually took a more simplified approach where we said, you know what, we're going to define a permanent setting as one that has a renewable lease with at least one. If the lease is not present, then we're going to call that an interim setting. The reason for this approach is because you'll see some overlap with some of these setting types. I'll point out tiny homes as you see it in both lists. And that's because of a lot of the feedback we received from the field and then through a lot of our own research, in that, there's a lot of innovations happening. Whether they're at scale or not, we see a lot of plans, a lot of things coming online. And, I'll say tiny homes, for example, I'll stick with that one. Some tiny home villages popping up in a lot of like rural type of things. And some of these tiny home villages have like their own kitchenette, their own bathroom, they have leases attached to them. You see some other tiny homes just kind of operating more as like a short stint for someone to have a roof over their head too. So it's like, how do we distinguish that? And we didn't want to have that unintended consequence of kind of just cutting off a lot of innovation happening. So that's part of the reason why we took the approach that we did, and just taking a very, permanent versus interim with the prominence of a renewable lease of 1 month. Next slide, please. Another I get is, well, it's great, but it's also only 6 months. What are we going to do to ensure someone does not return to homelessness and have that re-traumatization of returning to homelessness at the end of 6 months? And that's honestly a really great question. And I wish there was like a universal solution where we say, this is how you do it for everybody. The fact of the matter is, it's going to be individualized by member. And what we put forth is we're actually underscoring the importance of a housing support plan, which is basically a personalized map for someone's housing journey. And in that housing support plan, we're asking our managed care plan partners to identify, like, all right, when you authorize transitional rent, how is this member going to achieve permanency beyond that 6 months? We envision, especially with the behavioral health population, a focus for there to be connections to the BHA. For example, I mentioned how they have housing interventions. And, our general vision is like both of those resources together can create, a long-term rental subsidy in a braided fashion, but also just recognizing too, I would be very remiss if I didn't mention that, I think counties are also figuring out how best to utilize that 30% housing interventions. And whether like they can take on paying additional rent for eligible members. So I think that's, for this housing support plan, it's really important for our managed care plans to, work with their providers and identify, what is that permanency solution? What is the sustainability? So once we house someone, that they can remain housed and we're not burning through 6 months and then this benefit is no longer available to that too. So in a way, this is, upfront, what's the strategy for this person? And again, it's not always like BHSA, someone gets lucky and gets connected to like a housing choice voucher, but perhaps they just needed rent for a few months while they got connected. Or it could be someone has housing lined up, but we just need like a little bit of a gap filler through transitional rent. So there's a lot of different strategies at play. How those are deployed and how they go, I think that's something that we'll take a close look at as we get some more experience with transitional rent. But right now we're placing a strong focus on the housing support plan to help our partners identify what is that longer term strategy. Next slide, please. I'm going to touch on this a little bit, but a lot of this is still in the works as well too, as we're currently developing referral standards. Another thing that we looked at with transitional rent is how does this connect with some of our other services like enhanced care management, the other community supports. And our policy that we have in the policy guide right now is what we call like an auto off, where if you receive transitional rent, then you're automatically authorized for enhanced care management, housing deposits, housing intensive sustaining services. I'll just say that we are currently developing referral standards to standardize that and just kind of get a little bit more precise with that guidance, because not everyone's going to need all those services up front. But one thing I wanted to highlight here though is, for transitional rent, let's say we successfully house someone. The work really starts there. So when we get them housed, how do we keep them housed? How do we wrap that person around the services? And we looked at our own ECM benefit as a prominent role in that. So what we're saying with this policy is once a plan determines that a member is eligible for transitional rent, then ECM is automatically authorized. And that ECM provider will start conducting in-person outreach visits no later than 2 weeks after the person begins receiving rent. And the goal of that outreach is to, can that member to fully enroll in ECM, so the ECM provider can start, doing things to help situate that member, to help start addressing their health needs, and that includes like doctor's visits, what have you, but that also includes, things like maybe like I mentioned CalFresh as a prime example, connecting them with those kinds of services too. So again, we really looked at the ECM provider as a central figure to help provide those wraparound services or coordinate a lot of these services too. More to come on that in the coming months as we are inching closer to releasing referral standards. And in those referral standards, I don't have a slide for it here, but I'll say to folks that that's going to show like how you can like help a friend, family member, or someone or how the field will refer someone for transitional rent. So referrals don't just come planned down, but come from the community too. I think we've already heard anecdotes about, some members will just self-refer themselves by calling the plan directly, and those are all acceptable pathways. And we'll spell that out more in the referral. So that's something that we're currently on to. Next slide, please. Okay, so last segment, I know I've been talking a lot, and I'll spend just a little bit of time on, and then I'll get to questions. Can we go to the next slide? So again, we as a department feel very, very strong about that housing is health. And we have pulled on as many levers as we can to really address someone's housing as a healthcare need. We've done that through transitional rent and Medi-Cal, but then there's also the Behavioral Health Services Act, which was actually a voter initiative that was approved through Prop 1. We do envision that these services work together for members who meet BHSA eligibility criteria, but are also enrolled in a Medi-Cal managed care plan. We estimate that there is significant overlap, which is another way of saying that, hey, our delivery systems are serving a lot of the same people. And when we look at homelessness, or at least when I look at homelessness, I think one of the bigger issues that we have to solve for is how are we breaking down silos? I've seen many examples of where, counties are over-serving a member when a lot of that could have been referred to a managed care plan to take on some of those costs and take on some of those functions too. So in these next couple of slides, I'll talk a little bit about that. But again, we rolled out behavioral health population focus first as of 1/1/26 because in anticipation of the go live date for BHSA, which is July 1st of this year too. Next slide, please. So BHSA, I will spend a little bit of time on this. I wanted to focus mostly on Medi-Cal, but one thing I'll say about BHSA is that this was the previous Mental Health Services Act that counties have had for a couple of decades. It's funded through I believe it's the millionaires tax, and it's an ongoing funding source. And the thing with these funds, it's kind of like what I call a sequencing of funds, and it's spelled out in Welfare Institutions Code 5830C2, where it states that counties cannot utilize their BHSA dollars without going to Medi-Cal managed care plan service. So in a way, it really places the role of Medi-Cal managed care front and center as a payer first before BHSA can be leveraged. So all that to say is there
I believe Glenn cut out. Is that correct?
Yeah, it looks like he's frozen.
I'm going to take a moment to see if we can get Glenn back. 1 second.
Am I back?
You are back. You're back, Glenn. We can hear you now.
All right. Sorry about that.
We were having just a little bit of glitching. So if you want to go off video too, if that helps with your connection, you're welcome to do that too.
Sure. It's probably my computer telling me I'm talking too much. So I'll go off camera for now. Should I cover this slide again, or were folks able to catch what I was saying on this slide? Not quite sure where I fell off at.
I think we might be good with this slide if we want to move on to the next one.
Yeah, I'm going to go ahead and move it forward. Okay, so that all said, a couple of things we put in place is, we are trying to put some policies in place where our plans and counties are really working well together. And really what we did was highly encourage our plans through, one, just saying like straight up, like, hey, for county behavioral health, you have to offer them a contract to be a transitional rent provider. It's still up to the county whether to choose to contract or not. It takes two to tango, and there's many considerations that go into that. But we still expect a high level of coordination. So we also said if counties are not opting to contract, that's well within their rights. But we do ask that plans work with the county to identify the county's own network of providers. So that way the plan can work with those providers to help become transitional rent providers as well. So that's just our way of trying to like really blend the systems together. And honestly, it's counties know who their members are best. And it's to help our plan partners, find who their members are and have those relationships, and then just kind of building out their own network as well too. Next slide, please. All right. That said, that's it for my part of the presentation. I'm happy to open it up to questions, visit any slides. I'm gonna try to camera again, hopefully I can screen this time. I think I saw Tanisha first and then Graham.
Okay. You're still glitching for me, Glenn, and I don't know if it's my internet, but I had two questions. So in Alameda County, one of the things that we use when people contact 211 is housing problem solving. And we end up having a lot of people who might be placed with family as a quote permanent housing solution or an interim housing solution. So I wonder if someone is placed with family, would that then qualify as an eligible housing solution for them? Now, I know this is someone contacting 211, so that might create an issue if they haven't gone through the managed care plan, but it is just a thought that I had on the system level. If you would then be able to resource families who are receiving mentally ill or homeless, unhoused family members, so that that family can be able to, maintain a relative, but also receive resources through this program. That was one question. And then the second question I have was around who qualifies under behavioral health. So because I advocate for survivors of gender-based violence, oftentimes they're not qualifying under behavioral health. And so I'm wondering, is there a way that we can look at that eligibility and make sure that we're also including folks who are fleeing domestic violence and other forms of gender-based violence under behavioral health?
Gotcha. Great questions. I think the first one I'd start with is, for it to be an allowable setting has to meet those under the setting types that I listed out, but it also has to be a place where rent is actually charged and paid for too. So if it's not typically, we can't just pay rent to just, provide money as a means. It has to be somewhere where rent is actually charged for. And then I think, and I wasn't quite sure if this is the other parts of the question too, is if like moving in with the family a viable solution for like a housing support plan. I don't think that's what you're asking, but I'll just go there anyways. I think that is, right? That is someone being housed and they just needed perhaps 6 months of rent to, stabilize or enter into like a certain setting type before that they can move in with like a family member as well too. So I think those are things that the plan partners have to consider when looking at, an authorization. I think the other question was, what does it mean to meet the behavioral health population of focus? That's kind of like the clinical criteria where you have to meet access criteria for like specialty mental health services, drug Medi-Cal or drug Medi-Cal organized delivery system. So what that looks like is I'll try to explain as well as I could. I'm not the best expert at describing that part, but what it is like, you could either be receiving services from like your county behavioral health, like you meet eligibility for specialty mental health services, or you have a behavioral health condition that is prominent and known, and how we identify that's going to be part of our referral standards. But it's essentially like, do you meet some of that criteria for specialty mental health or drug medical organized delivery systems, like a presence of like a substance use disorder. It doesn't necessarily mean that you have to be receiving services from your county directly, but we hope to spell that out a little bit more in our referral standards too.
Thank you.
Thanks. Graham, I think I saw your hand up.
Yes. Thanks, Glenn. Appreciate it. Tons of information that you just relayed. Hopefully, we're able to get a copy of that, as I think it's a helpful resource, because there's so much that has been in the works and some of it's starting to happen. And that's actually where my question comes from. We just released earlier today the impacts of HR 1 on counties, and those impacts have a direct relationship with a few of the things that you talked about today, and I'm happy to populate the chat related to that. But the key points of that are that we have $2 to $5.5 billion in increased. It's basically a shift in cost of what's going to be indigent care for folks that would otherwise have been covered on Medi-Cal, but will lose eligibility based on HR 1. $3.4 billion in lost revenue in public hospitals related to HR 1. And so that's billions of dollars. And there are a number of the folks that otherwise I think would be receiving some of the services that you were describing that we all see as having value, that may no longer be on Medi-Cal to receive those services. So I'm curious how much of what you've been working on that we've been trying to put in place to leverage Medi-Cal in a smart way for California, how much of that is at risk, and what mitigations, if any, are there to try to salvage some of the devastating impacts of HR 1?
Yeah, it's a really good question, Graham, and I'd say that
I don't have any.
We're having an all-comer webinar to kind of go over our plans for HR 1 tomorrow. But the way I'll answer that is, for example, we are trying to do as much as we can on the front end to identify who these members are that meet medically frail criteria and can be exempt from like the work requirements, for example, right? So, we're going to look at, different data sources like our encounter data, for example, use of ICD-10 codes, CPT codes as well. So trying to do as much as we can and in terms of, I think the other thing that I think about too, it's like, how are our boots on the ground looking? I look to a lot of like our ECM providers who are they're there to help really connect these members for, if they know that these members might lose their Medi-Cal, like how are we solving for that? Or street medicine providers, for example, who often do Medi-Cal checks and everything too, can help identify these members as well too. So it's a great question, but again, we're looking at how much we can do on the front end through data, but then also I think we have to have more discussions on how we're dealing with that, with like our boots on the ground and how else folks can like really reach our members to ensure that they maintain enrollment and eligibility for Medi-Cal too.
Thank you. I wasn't trying to set you up. I don't have an answer. All we've done is the work of like the impacts are X, and y'all are trying to capture the same thing. So it's just, I guess it's to underscore, we need to find a way to work together to make sure we're because there'll be fewer dollars overall, and figure out the best way to preserve the most critical services to the populations that need them most. And so we're eager to have that conversation now that we have a better sense for what the impacts would be on the broader system.
Yeah, no, absolutely. Point well taken. And I think it's one of those things it's like an inconvenient truth what's happening with one. And yeah, it does put a lot of our members at risk, because for this coverage. And I couldn't agree more. And how we go about that, I think it's still like a ongoing conversation, and I know what I can share right now is we're trying to look at our data to see how much we can do on the front end.
Great, thank you.
Yeah, and I think I saw someone in the chat say our Cal ICH team, we will be sharing the slides, right, for folks.
That's correct. It'll be posted on our website.
Any other questions? Great questions so far. All right, I'm happy to hand it back. I'm not hearing any more questions.
All right, thank you, Glenn. If there are no more questions, we can move on to the next agenda item. I believe you also included, was it Appendix C? So I think we're gonna run through those and then go to the next, or yeah, just click through. Thank you. And then we'll go on to the next agenda item. All right. So this is agenda item 6. We have our general public comment. So we'll now accept general public comments. We welcome all comments and feedback. Due to the structure of this meeting, we may not be able to respond to any questions, but if you have any questions for Cal ICH or the committee, please email us at calich@bcsh.ca.gov. Everyone will get 2 minutes for their comment. A Cal ICH staff member will soon share their screen with a 2-minute timer countdown, and we will warn you when your time has expired. If you're connected through Zoom, select the raised hand icon in the meeting window on your computer. And for those joining us by telephone, you may press *9 to indicate that you would like to comment. And then once I call on you, you'll be instructed to press *6 to unmute yourself. All right, I'm gonna go ahead and check. I'll give it a minute for members of the public to raise their hand. So far, I'm not seeing any. All right, I'll give it a few more seconds. If anybody's looking for the raised hand button. All right, we'll go ahead and move on. Thank you for members of the public for joining us. If you do have questions, please feel free to email us and we'll be happy to get you a response. All right, I'm gonna go ahead and move us to final remarks. I don't know if Roxanne is still with us. I believe she had joined briefly, but she might have dropped off. All right. So we will skip the final remarks from our co-chair. And I'll go ahead and close out this meeting. So thank you all for committee members for your insights and your comments during our meeting today. As noted, these slides will be sent out and they are also posted publicly. Will be posted publicly after this meeting. Our next committee meeting is going to be on May 6th at 2 p.m. I also want to thank members of the public who have attended this meeting. We appreciate your interest in our work around homelessness. I know many of you who attend these meetings work to address homelessness either across the state or in your local communities, and we appreciate your efforts. We hope you all listen into our council meeting on March 4th at 1 p.m. And with that, this meeting is adjourned at 3:31 p.m. To receive up-to-date information on council activities, please sign up for the council's email list. There is a sign-up option, I believe, on our council's webpage. And we also encourage you to follow us on our Cal Speech platform, so Twitter, Facebook, and LinkedIn. All right, I hope you all have a good afternoon. Thank you.
Good afternoon.
Thank you.